So Meekatharra is an interesting little town. It's got a few facilities in it, which makes life easier. It's not too remote.
So Meekatharra Hospital is open. It's a 24/7 site. We have a GP that's on site or is available 24/7, as well as the backup from our emergency telehealth service. Staffed with what we call a 222 roster, so 2 registered nurses on every shift, with also the support of patient support assistants who obviously provide support services to the hospital, but also assist in caring for our residents.
Average sort of presentations during the week is normally sitting about the 30 presentations mark. They can go from someone that's not been able to get a GP appointment up until major trauma. We fly out an average sort of 2 to 3 patients a week to Regional Centre Geraldton or to Perth. We have a St John's ambulance service as well. They'll bring patients in from Kew or Mount Magnet if they need treatment here. We have really good clinical support and clinical pathways, protocols to make sure we've got the best care we can provide.
I'm the senior clinician for CAMS, Meekatharra. CAMS is Child and Adolescent Mental Health Services. So we are based at the main hospital around the Meekatharra Murchison region. I moved to Meekatharra about a year ago. Meeting parents, meeting other professionals from other organisations and doing my therapeutic work with children. The kind of demographic that I cover, the population is very interesting, and I find that the work that I do here is quite hands-on. I do most of the practical stuff myself, so I'm never bored in my work.
At Meekatharra Hospital we have visiting services that most of them come from Geraldton. We have some that come from Perth. Allied health, mental health, child health and other visiting medical specialists all visit on a regular basis.
It's very different here from Metropolitan, and it's very different from other remote settings as well. Because we're so far away as well, you have to think outside the box a lot and be very adaptive to work your skills to fit what's needed of you. You can call the on-call nurse in to help on site if you have anything that's out your scope of practice. You're not left alone. We're really, really supportive.
All the staff have been so welcoming since I've been up here. It's incredible. I struggled a little bit because I didn't know anyone, but they've all kind of become family, and they're all supportive. They'll always check in on you, make sure everything's okay.
It's laid back. Everyone gets on good. Yeah, it's just all around a good place to be, to work at. Yeah.
If you're on a longer contract, we will allocate you a house. We've also got a complex called Havelock. In summer season, we have a fully functioning staff pool that you can access. It's really, really good accommodation. We've got a 24/7 security guard on site who's got a car. The houses have got security cameras at them. The security guard does a patrol.
You have more time to learn in different cases. You learn about the patients, you learn about what they really need. And you don't only learn clinical skills, but you learn about the culture, which is awesome.
There's a lot to be said about coming out to remote areas to work. It's totally different from Metro. Meekatharra is quite well placed with facilities. We have access to a gym through the Shire. There's a couple of pubs in town that are open, and the food's quite good in both of them.
There's some really good locals down there and everything like that. Have a good chicken palmy.
We've got a coffee shop in town, we've got a pharmacy, we've got IGA. We have a lot of miners in town that will come into the pub as well, so they're out of towners, fly in, fly out. There's quite a young crowd that actually goes to the pub, and the nurses tend to all hang out together, and they've got a little social gathering going.
Meekatharra is a beautiful place, but it's one of those places that you've got to make the most of. You've got to be willing to go out and do things, and they go to the hotel and have dinner, and you've got to make friends with people at work and make that effort.
There's always something happening, there's a market, you can go to the markets. Young nurses, they go camping, they go walking, they go to the granite.
I think one of the benefits that come into country is you become part of the community. If you want to, you can be involved in all the community activities, and you'll probably feel like you've got a family, a home away from home. Often small country towns, wherever they are in WA, are very welcoming, and if you're interested in sport or any of those sorts of things, you're often welcome with open arms to be part of that community. Having worked all across the country and country WA, and particularly in Midwest Murchison, I think the thing that makes these sites such amazing places to work are the team. It's the actual staff themselves that are open-minded, flexible, resilient, willing to learn, and open to those opportunities, and and willing to become part of the community.